Hello, Gold participants and listeners from around the world. I'm Kristin Schwarz, licensed midwife and MC for Gold Learning. And here at Gold, our preparations for the upcoming Gold Online Conference, Lactation Online Conference of 2020 are in full swing. And the conference is just around the corner, getting started at March 30th. And before the conference, we always like to get together with our speakers and talk a little bit about not only about the upcoming presentation, but also their work in the field and what they're up to. And today with me here is Dr. Sonia Semenic, and it is so wonderful to have you here, Sonia.
Thank you very much. I'm delighted to be part of this wonderful training opportunity.
That is absolutely wonderful. And yeah, we're going to talk about your presentation in just a moment here. But before we do so, Sonia, you are an associate professor at the Ingram School of Nursing in Montreal, and you also used to be you are an IBCLC and you worked as a nurse specialist. So tell us a little bit about your professional journey and how did you pivot over from the work in the field to the academic field?
Well, I actually started off as a psychology student and I did nursing as a second career. So I had an undergraduate degree in psychology. So I've always been interested in health behaviors and health behavior
Mm.
change. I did a master's degree in nursing and I started off my career as a staff nurse on a postpartum unit and soon thereafter became the clinical nurse specialist for the unit. I developed a very strong interest in breastfeeding and breastfeeding practices when I saw the huge gap between what we know we should be doing
Mm-hmm.
as care providers to support breastfeeding and what I actually saw happening in the hospital, which was a very large tertiary university affiliated hospital. And it's been something I've been working at for years, the fact that we have this mountain of evidence for how best we can support mothers and babies to succeed at breastfeeding, yet so much of this evidence that we have fails to get applied in clinical practice.
Mm.
Um, I One reason I decided to go back to school and pursue a PhD was to study the field of implementation science
Mm.
further to,
Yeah.
see how we can further contribute to improving care practices. And my original research program has been focused around breastfeeding support, breastfeeding practices. My PhD study looked at factors influencing the duration of exclusive breastfeeding among first-time mothers. So that
Mm.
one was more focused on what were the barriers and facilitators for mothers to pursue their breastfeeding goals. But I quickly realized that a lot of the barriers are really at the institutional and organizational level. So for my postdoc studies, I did a training at the in community health nursing at the University of Ottawa, but with a focus on learning more about knowledge translation. And I took courses with some knowledge translation experts in Canada. And that's when I really sort of pivoted towards my research program became much more focused on factors influencing the uptake of evidence-based practices within institutional settings.
Mhm.
So I'm no longer an IBCLC because I no longer do clinical practice, but I've maintained a lot, a research program looking at breastfeeding support within different kinds of organizational levels and different types of organizational healthcare organizations. Um,
Mhm.
for example, I received a big contract with the Quebec government to look at the implementation of their breastfeeding policies, which is very focused primarily on widespread implementation of the baby-friendly hospital initiative. And through that project, I've become involved, at the international level as well, looking at implementation of the baby-friendly hospital initiative. I've been involved through colleagues with the development and implementation of the NEO-BFHI, which is
Mhm.
our new guidelines for baby-friendly care for premature babies. And my my research interests now are also expanding towards breastfeeding support in the neonatal intensive care unit, which offers a whole new range
Yeah,
of barriers for breastfeeding
absolutely.
support.
Absolutely. And I hope you'll be back with that presentation when you concluded your research there as well. That's absolutely fascinating. I hear that you are involved in international efforts as well as national efforts, and you mentioned there the Canadian government is supportive of the baby friendly initiative and actually helps with the implementation. Is that correct from what you were mentioning?
Yeah, well, actually, Quebec was a leader in Canada in terms of,
Yeah.
healthcare in Quebec, in Canada is under provincial jurisdiction, and our province
Hmm.
was the first province to actually have a provincial level breastfeeding policy. And since then, many other provinces in Canada have adopted policies towards um, providing support from the government level to implement the baby friendly hospital initiative. I think we still have a fair ways to go in Canada. Like
Yeah.
in most Western countries, the uptake of the BFHI is much greater in the developing countries.
Hmm.
So, but there is, Quebec has played a leadership role in implementation of the BFHI as well as now as in implementation of the neo BFHI.
Hmm. That's really good to see because, I can only imagine how hard it is to get that kind of support and get that started, on that level. It's not an easy thing to achieve, and it's good to hear that there are so many good works in the, developments and the works there as well. That's fascinating. I am so glad you are here and you're going to be speaking about this topic about moving from evidence to practice, knowledge translation, and breastfeeding support. That's your title of your presentation. And you're absolutely right. I mean, now more than ever, we have access to research, right? We're living in the age of the internet. Many of us can just look up the research. And many of our listeners who are listening here and coming to Gold, they are just thirsty for knowledge, thirsty for research. And but then there is this gap, this huge gap, how to apply this, research and evidence-based evidence to practice, actually. And you mentioned something there, especially with institutions, right? Hospitals and clinics and so on and so forth. There is that gap. And I, when I saw that you will be presenting on that, I get really, really excited because I can, this is like, yes, this is exactly what we need to know. We have the information, we have a lot of research, and there's new research coming out every day almost. And but what can we do with that? This is implemented. We know how important breastfeeding is. How can we get this to an institutional level where it's implemented? So tell us a little bit about this. Tell us about your topic and what you will be presenting on a little bit more.
Well, one thing that we need to acknowledge is that having the research evidence is only one part
Mm.
of evidence-based practice. So we still have to integrate the existing knowledge, the available knowledge that we have in terms of best practices with, the resources and the context within the particular organization we're working with and within the particular country that we're working with, as well as we have to also integrate this with the needs and preferences of families. So, there's a lot to juggle in terms of defining, what is best individualized care when it comes down to the care providing you are providing to that individual um, mother baby dyad within her family system, within the context and culture that they're in. So it's one thing to have evidence for
Mhm.
what could be best and what would, but that needs to be tailored to each individual situation. Also, employing the care provider's own level of clinical and experiential knowledge.
Mhm. Mhm.
But there is still the fact that, and I'm thinking in terms of, for example, the WHO's 10 steps to successful breastfeeding. There's solid evidence behind those recommendations that were specifically developed to help healthcare institutions uh, provide optimal breastfeeding support. But there's so many layers of factors that
Mm.
might influence whether or not that evidence is being used. And these factors might be resource issues
Mm.
within the hospitals. There might be attitudes, attitudinal and belief systems that might influence breastfeeding practices. There is the juxtaposition of the mother's needs and demands and versus what the healthcare providers might think is best. So it looks easy on the surface, but when you begin
Right.
to, peel back the layers of the
Yep.
onion, you realize how many forces there are operating for and against the use of evidence. My concern is that we often end up with blaming the healthcare providers for not
Right.
implementing the evidence without thinking about the context that the healthcare provider is working in, all the myriad reasons that might be influencing whether or not, what some person might consider best practice is being used versus others.
Absolutely. And in some of these institutions or big hospitals, they're part of, at least here in the United States, are part of big corporations, right? So
Yes.
putting something, and they're not like, if I look around here at the hospitals, for example, they belong to a group of hospitals. It's very rare to see a hospital just by itself where you could just go in an ideal case, right, and start implementing things. They're part of this huge national chain of hospitals. So that is another barrier too, where it makes it really difficult to implement changes because it's just not on a local level. It's it has further reaches, and the barriers are so much greater in that as well. But in your what have you also seen from the consumer side? When I look at what has implemented in hospitals, around my area here, there's a lot was consumer driven, right? I mean, it was driven by families that demanded, we want better C-sections, we want rooming in, we want support. Do you see that as a driving factor as well in?
In Quebec, I think historically the breastfeeding movement that the government finally latched
Mm-hmm.
onto, no pun intended, was really started as a grassroots movement in reaction to, the lack of support that was available for breastfeeding mothers.
Right.
We have reached a point though where there's a bit of a resistance growing
Mm,
towards all this breastfeeding promotion that's happening, from mothers who feel that, decisions to not follow the norms, for example,
right.
um, if they're based on um, informed decision making, we've run into issues where people are feeling that mothers are being overpressured now
Right. Mhm.
to breastfeed and to follow the norms. And again, evidence-based practice involves integrating and taking into consideration what mothers' intentions were, assuming that these intentions are um, you know, informed by that their mothers are making informed decisions about the risks and benefits of exclusive
Mhm.
breastfeeding, for example.
Right. Yeah. And there are like many barriers also for these families for the women, right? I mean, you mentioned the pressure that there's now a kind of a pushback because they feel too much pressure because they often don't have the support they need to, and feel overwhelmed with the information and the pressure to kind of be exclusively breastfeeding and don't have the support in their network as well, where they can really implement all that.
Yeah, and one study that we completed a few years ago in Quebec, we did a large population-based survey of mothers' needs and support for breastfeeding. And what we're finding is that we are doing a lot of breastfeeding promotion in Quebec,
Hmm.
which I think is very positive. But at the same time, there is a danger if you are not following that promotion with adequate resources in the
Yeah.
hospital and in the community. We, mothers had um, very wonderful perceptions of breastfeeding peer support programs and that kind of more informal support. And the biggest complaints really were about the lack of availability of support within the
Right.
hospital settings.
Yeah.
Um, so a lot of my research now really focuses on those large institutional settings because,
Hmm.
the lack of support is often related to resource issues.
Yeah.
In Quebec, we do have we don't have private systems. We have publicly funded systems. We have lots of issues with nursing shortages and lack
Mm.
of money and
Mhm.
resources for proper training of healthcare staff. So, these are issues that do arise. Another big issue that we have to grapple with in the field of implementation of evidence is the fact that breastfeeding support is just one part of what maternity care staff and nurses have to do in the
Yeah.
hospitals. And there's, a barrage of information coming, across that they need to integrate into their practice that touches all aspects of their work. And we know that
Hmm.
there's issues like, just over information overload, change fatigue, being
Yes.
asked to constantly adopt new practices related to everything they do. So part of the issue is, how do you make breastfeeding support a priority for practice change in these institutions? And that's really part of the key to successful organizational change is,
Yeah.
you know, how
Yeah.
do you kick the can of breastfeeding further down the road than other priorities that are needed? And supporting breastfeeding is not as, interesting or sexy for hospitals as, improving cardiac care or
Yeah.
improving emergency
Mm.
services. So there's always that, fighting for the resources that are
Yeah.
needed to, prioritize breastfeeding as a practice that needs improvement and needs to be more evidence-based.
Absolutely, absolutely. That makes a lot of sense. And as you mentioned, care providers are often blamed, for not. But as you mentioned, there's shortage of nurses. They're over, extended in their what they have to work on, and constant change results in kind of a, overwhelm and too much, and also pushback from their side. And now finding the right way to get the resources allocated, and give also the care providers the support they need to be able to support the families is really important. So absolutely makes a lot of sense. Now, with regards to your presentation here, so you will tell us a little bit of what you will be covering, and to conclude, what are you hoping our delegates will take away from it?
I was hoping that people would, learn a little bit more about the whole process of knowledge translation. I mean, this is something that, you know, was key to the success in my practices related to trying to influence practice change. It wasn't
Hmm.
until I did a postdoc that I actually started reading about this whole field of implementation science. And there's some sort of basic principles involved that we don't often think about. And, if we want to be able to understand why evidence is not being integrated into practice, and what are the possible things we can do to help, you know, move breastfeeding practices forward. Um, there is some basic principles that we can cover. So I was hoping to just, this is really a introduction 101 to the field of implementation science, but I will be using an example from my own clinical practice to show how you can integrate some basic principles, models, theories in the field of knowledge translation into your thinking and planning about how to possibly um, influence change and how to possibly enhance the uptake of evidence-based practices in breastfeeding.
Wonderful. That sounds really exciting. And I like that you will give us actual examples of how, how this is being able to, how our listeners could achieve this in their own practice, possibly, and take this as a next step forward. That sounds very exciting.
And some of the models and principles that we use in the field of implementation science are equally applicable to individual patient care. So just,
Right.
one of the models that we'll be looking at, the behavior change wheel, was actually developed uh, to help um, patients adopt um, health behaviors. So it
Hmm.
really is a model of health behavior change that has then been, taken up by the implementation science community and applied to how we can help staff change behaviors related to their practices. So hopefully, some of the things that we'll talk about will be applicable to, um, the individual care that our listeners might be providing as breastfeeding support persons.
Great, absolutely wonderful. I can't wait for your presentation, Sonia. It sounds really interesting, and something we really can use and learn about the knowledge translation there, how we can use that in our practice and maybe even in our institutions going forward. Thank you so
That's great.
much.
I'm really looking forward to giving this talk.
Thank you so much. So, to our listeners now, the presentation Moving from Evidence to Practice Knowledge Translation and Breastfeeding Support is part of the Gold Lactation Online Conference of 2020. This presentation will be live on April 6th. And this, as I mentioned, is part of the Gold Lactation Online Conference. There are 26 speakers in this conference and delivering over 28 hours of accredited education. And this is our 14th year for this amazing conference. And this year, year, we have added some really interactive elements such as panels, workshops, and Ask the Expert and case studies. So to find out more about these presentations that we have here with Dr. Sonia Semenic and the other presentations in the conference there, please visit goldlactation.com. And I hope to see you at our conference. Thank you everyone for listening, and goodbye for now.